oral formulas. So, knowing that, what molecules do we prescribe to our patients now? Well, the first is liposomal glutathione. Because when you give regular glutathione, it's a tripeptide, it's only 3 amino acids, which are very hydrophilic, and they will not pass the cell membrane. When you give oral glutathione, the only thing you induce is a very expensive urine for the patient. Because the gut will absorb, but it will not penetrate cell membranes. It just appears in the urine. So you have a very slight chelating effect, but very expensive and non-working for the patient. When you give liposomal glutathione in the right amount and in the right conditions, you improve oxidative stress very quickly. So the first thing we give in all chronic disease is liposomal glutathione. The second then is we give liposomal resveratrol curcumin, the combination, if inflammation is part of the process. And as I argued, that's in many cases. Then we have the availability of liposomal DHA. We have liposomal CoQ10. You would argue, well, ubiquinol, it comes from Kaneka, Japan, is superior to ubiquinone with the N. That's true. But liposomal CoQ10, which is the old version of Q10, the ubiquinone, but in liposomal form, it's 5 times more active than the ubiquinol. And our manufacturer has said, oh, I can also make liposomal ubiquinol if you like, but the price would be too high for that. And because this is already so effective, many cardiovascular patients, 1 teaspoon a day, it's 100 milligrams or so, but it is, you can convert it to 500 milligrams of ubiquinol. So it's so potently active that many patients report increase in energy levels within a week. And when they start chelation and you give this with it, they associate the chelation with the improvement in complaints. So you have convinced the patient to continue the treatment. And for those who like the C, you can also give liposomal C. It's much better. It's 10 times more effective than oral C. And now it's now being developed for cardiovascular problems and for osteoporotic patients. We will shortly have a liposomal combination of vitamin D3 with K2. And you would argue, like with the DHA, well, it's already fat soluble. Why would you do that? But even those are 5 times better absorbed than the standard formulations. So I see a future where we will do not much of chelation intravenously anymore, but that will take some while. But we will only give, and no more capsules and tablets. So it will be whether a powder, sublingual, or in these instances in liposomal forms. You only need to take a few teaspoons a day of each, or just one of each, and finished. You don't need any more. Not anymore like I used to do in the old days as well. 27 capsules because the E is good and the B1 is good and the curcuma is good and these. No, those days are gone. A few teaspoons a day and it's finished. Somewhat about resveratrol. Therefore we combine it because it also has very potent neurogenesis effects. Well, everybody knows resveratrol and all the things it can do. But our main goal is that it improves the biosynthesis of mitochondria. So when you clean them a little bit with the detoxifying agents and the liposomal glutathione, and you then improve their genesis, then the cell will have the opportunity to regenerate. There are even now studies underway, randomized double trial for Alzheimer. They give 2,000 milligrams per day because it's so poorly absorbed. We would only need 2 teaspoons for the same effect. And they see some changes with only 1 ingredient, but okay. Here in colitis, double-blind study of the effect of resveratrol. So it is very obvious it's a potent anti-inflammatory agent. Here, maybe lesser known here, beta-sitosterol. In this study, you see lipopolysaccharides from bacteria. They cause a very tremendous inflammation. And the higher the dosage of beta-sitosterol together with these inducing agents, then you get a very potent anti-inflammatory effect. And I call it the modulator. If you have allergies, then you have too much of Th2. When you have cancer, you have too low of Th1. And you can give either patient the beta-sitosterol because it's a modulator. If Th1 is too low, it upregulates. If Th1 is too high, it downregulates. So then, we also treat the intoxications. You have to see this not in, I do this first, I do this then. No, it's a total package, of course. So we do the chelation and the phycocyanin. We stimulate phase 3. We do this with laminaria, and we now also use the phycocyanin. That's a blue algae. When you use spirulina, we now have the concentrated form, liquid. This is the molecule, one of the molecules which looks like phycocyanin. And it's a very potent intracellular detoxifying agent. You don't want it on your clothes because it's like red wine, it really stains, but then blue. And it's a bone marrow stimulant, but it's a anti-cancerous agent, especially for myeloid leukemia. It stimulates natural killer cells, thereby also anti-carcinogens. It's antiviral. It decreases type IgE allergies. It quenches free radicals. It's 70 times more potent than our own SOD enzyme. This is all literature. And it's a natural chelating agent for both metals and non-metals. Can also bind specific plastic substances. Here we have a patient you've seen before with a high of the very low zinc and the very high cadmium. So I give her liposomal glutathione, the methylated form of silicon, zinc lozenges, and phycocyanin. That was after 6 weeks. Many patients don't want to take something for half a year to see a change. And when the patient is reporting, oh, my hives don't occur every second day anymore, but is now once a week or even once in 2 weeks, then you know you are on the right track. When the patient says, oh, I think I sleep better, I'm not so often awake anymore, and I feel a little bit more rested, and you can check it with the chromium, then we know, okay, patient is doing better. Here, an example of a patient in a very polluted area in Belgium with very high oxidative stress. This, of course, is again one of my best examples, just to show what is possible but will not happen in every patient. But here the oxidative stress improved really dramatically with a reduction of toxic metals as well. And he got the DTPR DMPS treatment. He got the full sanitation of all his amalgams. He used for that also laminaria, phycocyanin, liposomal glutathione, and monthly injections. It's not monthly, but every time what we do, the biological dentist removes amalgam, and directly after the treatment from the dentist, because then a lot of mercury is mobilized, within a few hours they need to visit the clinic, we inject DMPS, and all mercury that is coming into the system will be bound by the DMPS. So the redox status, you improve the best with liposomal glutathione. Here we have a person with post-traumatic stress disorder. It's a kind of same profile, very low phosphorus and very low chromium. when it's non-obese, and the people tell you, hey, oh my God, I'm so in stress, I'm burnout, and he was very tall and very slender, so he has not metabolic syndrome, but he had a severe sleeping disorder. So cortisol also causes insulin resistance, and therefore you see chromium loss. And how you can see what I did here, the cobalt increased very dramatically. What did I do? I gave him the activated B vitamins with the methylcobalamin. Neurological stress, etc. As I said, I mostly give one course of 2 months. It's 60 capsules, 1 a day, of these activated bivitamins. So I know that whole metabolism, Krebs cycle, etc., they all are dependent on these vitamins. And when I give one course of that, mostly it's okay. Maybe some people afterwards would need some more, but not even every day then. But you see it in the Oligoscan after a few weeks, because the excess of methylcobalamin will appear in the skin, which is not a toxic effect, it's just an effect you see. That you see that the therapy you do is controllable, and that also the device you use is controllable. Here another one where I just want to highlight the very low phosphorus, phospholipids, ATP, and the high mercury, which has been decreased with what? Liposomal glutathione, phycocyanin, and the activated B vitamins. Here it went from very low to just normal. Sometimes it's from very normal to a little bit excess. I don't care about the excess of cobalt, because it's a good form of cobalt. It's methylcobalamin. Here I want to highlight the very low sulfur. If sulfur is low as this patient had, there is no detox possible, even with the most potent synthetic ones we use, because when there is no sulfur present, the cell cannot get rid of its toxins. So you need to first address this. And of course, I gave liposomal glutathione, but the sulfur was so low that I was also concerned about the total sulfur pool, like the iron sulfur clusters. So I also give the very cheap and simple N-acetylcysteine, which is the best form of regular sulfur to donate. I also give the zinc lozenges, as you can see, from very low to a normal value. We reduced, in my axis, we have had no inflammation toxins to reduce stress levels. You can make use of adaptogens, like Siberian ginseng or any other ginseng. I preferably use rhodiola. Rhodiola rosacea is for me the best 2 capsules in the morning. I've seen many good changes with the heart rate variability test after a few weeks. People are really coming back in their cortisol level again. But you can also use any of these or what you prefer. But just think of improving stress levels as well. Good old chondroitin, not only for your cartilage, but it really modulates inflammation as well. Systemic chondroitin sulfate reduces this important cytokine, which induces inflammation in both macrophages and liver cells. And it is involved in inflammatory bowel disease, atherosclerosis, Parkinson's disease, etc. So you can use chondroitin sulfate. It's also a very versatile agent, mostly forgotten because everybody only thinks of cartilage. Here, this study, antioxidant, etc. effects of chondroitin sulfate. Then we use specialties, because I promised you to introduce a substance to stop the progression of Parkinson's disease. And one of that is Vicia faba. That's a bean. It's a very simple bean which we eat in Europe. And one specific part of that contains a lot of dopamine, L-dopa. But there is another herb, Mucunia pruriens, which does the same, but the problem there, dopamine, as I explained, auto-oxidizes very easily. So you need to have something which protects the dopamine from auto-oxidation. And the Vicia faba bean contains a lot of carriers which protects the dopa. So you get a steep rise in dopamine level, but protected by several of these carriers. So therefore, my statement, sometimes dope is good. And in all chronic disease, you have a loss of noradrenaline, adrenaline, and dopamine, because the chronic intracellular stress, not only mental, but also the physical stress, will cause a very strong disturbance in that catecholamines. And it's all about the vagus nerve. I can tell you the highlight here, but autism is located in a very small spot in the brainstem. There it arises. Autism is not a gut disease. Autism is not a psychosocial behavior disorder, as some would like to say it, but autism is a disease exactly there. It's called the nucleus tractus solitarius, and there arises the vagus nerve, the vagal nerve. That is chemically castrated in autism. It explains all their complaints, from organic to mental. But also for chronic disease as we have, infection or tissue injury, PAMPS or DAMP, they can cause through cytokines or directly activation of the afferent vagus nerve. The brainstem regulates symptoms or signals up and down, but through the same vagus nerve, there is a signal to the ganglion celiac, which has to release norepinephrine to inhibit. That is the only time that norepinephrine inhibits something, to inhibit inflammation in the spleen. And the spleen produces acetylcholine to reduce the inflammation of the macrophages. But you need activation for active inhibition. So that tandem, that duo of activation and inhibition is very important to have balanced. And in all chronic disease, this is disrupted. In an overview here we see our DAMs and PAMs from the first slide, but you need the vagus nerve, a good functional vagus nerve. Many good devices now, very cheap, which can measure heart rate variability, which is a direct function of that autonomic nervous system. It's very easy controllable and easy repairable if compliant by the patient. But you need to decrease the inflammation and to decrease the toxic load. Otherwise, you cannot reduce the stress. And conventional levodopa has a big problem because it auto-oxidizes, but this preparation is called atremorin. It's just a brand name. And the Spanish doctor who developed this saw a dramatic increase in the dopamine. This one is important. Normal people who don't take anything, very low dopamine. Healthy people who take the atremorin, a very strong rise in dopamine in blood. You are very focused when you use that. Detectable and feelable on the first day you take it. It works immediately. Here you see Parkinson patients on Parkinson drugs who have just the same amount of dopamine as a healthy people who just takes this bean as an extract. But when a Parkinson patient uses this bean, the dopamine rises sky high. So what you need to do when you have a Parkinson patient and he comes in and is willing to take this, if the condition is less than 3 years, you can stop the disease almost completely. You reduce medication by at least 50% directly and you take one morning sample of 5 grams of that powder. If the patient already has 5 years or longer Parkinson's disease, then the complete substantia nigra is already 90% destroyed or more. So they will need more of the powder with a low dose of the conventional treatment, because the levodopa can react with the carriers in the powder, and that can make the rise of the dopamine constantly and at a protected level. And many patients report, because when I got that about 7 months ago, I got 24 bottles for nothing, just to try. I give it to 3 of our Parkinsonian patients, and 1 day later, I still get a little bit of goosebumps. The wife of the patient called. My nurse said, she's on the phone. I said, uh-oh, what now? I thought a side effect or something like that. But the only thing she asked me, doctor, how many bottles do you have left? Because she just was worried that after the bottle was empty, that her husband could not continue, because he felt the improvement in his kinetics within hours after the first dose. But keep in mind that you reduce the traditional medications, otherwise you get dyskinesia. Then the dopamine is too high, and then you start, then it's really dope. That's not a good dope then anymore. This has been published in this magazine. This was the conclusion, that it is a very powerful pro-dopaminergic neuroprotectant. In mice, so far, you see a stop of the illness, and they move better again, they behave better again, etc. He also investigated some other things. Urea, a nitrogen product, very statistically higher in Parkinson patients. The phosphorus, statistically significant, much lower in Parkinson patients. You now understand all why. It's all cell membrane function or nitrogen stress. And here the B vitamins, the methylating vitamins, statistically significant lower in Parkinson patients. Therefore, I give a lot of the B-activated vitamins. And then lastly, berberine. It's not only a multipotent combat against Alzheimer's disease, it has many effects. But I'm interested especially in the other activities, because I will prove you that many people have leaky gut syndrome, or is associated with leaky gut problems. I will prove you that berberine is the first ingredient to heal leaky gut. This is healthy gut. It is colored for 3 types of tight junctions: zonulin, oclidine, and claudine. You see here nice cells lining up to each other, very tightly bound to each other. Here you have a control group where they give berberine. Well, it was already healthy, but when you look carefully, you see that these tight junctions are even thicker now, even more tight. But now we see when you have hyperinflammation. So here they give interferon gamma and tumor necrosis factor alpha, and you don't see any coherent epithelial lining anymore. This is the moon landscape. This is leaky gut, how it looks like. And when you now give these same cytokines, but you add berberine, you get this. It's almost completely cured. So can you imagine when you also reduce the inflammation, and then you can also give the berberine and the other ingredients we talked about, how healthy the human gut can become. And there is one big advantage of our gut, the small intestine. The cells divide every 4 days. So within 2 cycles or 3 cycles of at least 8 to 12 days, you can have a complete cure of your gut if you uphold the diet and the other restrictions necessary to reduce inflammation. And this is what berberine does as well. I did not know, I have a slide in here. Here you see high zinc, which I told you in the beginning, a sign of liver or chronic inflammation. When you give 4 weeks of berberine, you see a dramatic normalization of the zinc. When copper rises as well, it's then a worse condition, because that means that you even produce more cytokines. So in most cases, non-alcoholic fatty liver degeneration, you give 2 to 3 times a day 500 milligrams, and berberine mimics completely metformin. You can give berberine to cardiovascular patients, to leaky gut patients, to cancer patients, and also to diabetics. Because when they use metformin, in the same dosage, berberine does exactly the same. So these are all indications you can use for berberine. I just mentioned them. I did not mention the first one, and that's it is natural antibiotic. It kills all pathogens except virus. It cannot kill a virus. But fungus, bacteria, there's one hospital in the Netherlands now, we have sometimes the multi-resistant Staphylococcus aureus, which is very resistant, and in their cleaning water they use now in the operation rooms, they use extra berberine. Because in vitro, berberine kills MRSA, the multi-resistant Staphylococcus aureus. So, do I have some other supplements? Yes, but I talked about that. CoQ10, helpful in multiple sclerosis, double blind, very high dosage, 500 milligrams. We just use 1 teaspoon of 100 milligram liposomal, because liposomal is also absorbed much more efficiently. You saw this already. DHA counteracts cell death by mercury. In this study it was shown, but liposomal form of DHA is even absorbed much better. And now I come to a complement for the Chinese, or for the Japanese, because there's a big difference. The genes between Chinese and Japanese are the same. It's the same genetic markers, etc. Only the average lifespan here is much higher than in China. So it's not only genes which regulates this. But this we have found that spermidine and spermine, they are enriched in people who get to the age of 90 or 100. Previous results that these polyamines, these are called polyamines, are high in people who have high age. They don't know why, but I come to that, but it is a fact. But when I come to my scheme before, my radical scheme, this was all detrimental. So when the nitric oxide can be prevented, then this and this can all be blocked. We don't lose it, we don't generate this, we don't lose the glutathione. And what happens? When you have the M2 macrophage, that's the anti-inflammatory macrophage, then it diverts the arginine to ornithine. And when you then have good methylation, because you need a product of the SAM-A, the S-adenosylmethionine, you need it even twice, then you are able to produce spermine and spermidine. And only then, low inflammation or non-inflammation and no toxins, only then you are able to produce these substances, and with the right genes, maybe be able to reach the age of 90 and 100 in a good condition. And when you now use your laminaria quite often, and you make sure your inflammation is low, and you make sure that your methylation pathways are correct, then you have at least the setting for this biochemical pathway to occur. And this is what happens when you have a lot of spermine, then this gene is upregulated, and that means protection. I don't want to go into details, but here you have a study. Spermidine reduces lipid accumulation in atherosclerotic plaques through autophagy, and that is the key word here. When we have a cell with a lot of toxins inside, we have cell organelles which are blocked, which don't function well. When you have enough spermidine, that's a signal for the cell to go into autophagy. So the cell very nicely breaks down itself, and all the nutrients are taken up by the immune system, diverted here and there, and all the toxins are nicely packed and removed from the system. That's what spermidine can do for your body. Here also, spermidine protects against neurotoxicity caused by this alpha-synuclein. That is the substance in Parkinson's disease. Beta amyloid is Alzheimer, alpha-synuclein